Nature has the power to transform, slowly but surely changing everything it touches. It ebbs and reduces, taking away volume, leaving the marks of passing time. But nature also has the magical power to regenerate, to invigorate, and to restore. As time passes, nature also has a transformative effect on our own appearance. Faces can lose some of their collagen, and folds and wrinkles may appear around our nose and mouth. Radius has found a way to use a little restorative magic to return that lost collagen, to give you back a natural, younger look immediately, and to keep that look for a long time. Radius is unlike many treatments that have come before it. It really does seem to work like magic because it's effective immediately and then continues to work with your own body to produce a lasting, natural look and feel. The treatment is so simple it can be performed over a lunch hour, and the transformation is noticeable right away. The natural, youthful look stays with you. For many patients, this effect may last a year or more. If it seems like magic, that's because it really does have a magic ingredient, and that ingredient is you. Because your own body works in partnership with Radius in a remarkable way. The science behind this magic involves a process called collagenesis. Radius magically starts this process by stimulating collagen production in your body and encouraging collagen to grow around the injection area. Radius contains smooth microspheres that are injected into the skin through a simple, safe, and minimally invasive procedure. Once it's injected, our little microspheres make a big difference. They add volume to Radius, optimizing its immediate effectiveness at smoothing out wrinkles and folds. This unique feature of Radius is truly a wonder of nature, helping your body create its own naturally younger look by combining our microspheres with your own natural collagen.
My name is David, and I'm a patient at Essentially Bare. And I knew that, over the long term, if I wanted to maintain some sort of skin health, that I should do something about it. So I'm in an advanced skin care treatment called Obagi. I've had Botox, and I'm a convert. I knew that this was a very popular procedure. What I didn't understand was that, a lot of people do it for preventative methods as well as just to, improve the way they look today, tomorrow, and next week. The nice part about the reaction that I get from sort of friends and family and people who know me is that, the treatments haven't resulted in a dramatic or unnatural result. They've sort of resulted in a fresher, more a healthier appearance, and not necessarily an unhealthy or a plastic or an unmoving appearance. So it's been really great to encounter the reaction, and people have been fairly vocal about it. It's been really kind of fun. And then I've also had laser hair removal, which for me was an issue because I had an awful lot of irritation on my skin as a result of shaving. I mean, the clinicians here are friendly, they're informed, they'll sit down with you and craft out an entire, a custom-built regimen for skin health and any other procedures that somebody would be interested in. And I've been really impressed with that. They've taken the time to really look at my skin and sort of map out a plan for achieving the results that I'm interested in. So that's been very gratifying.
Art can be awe-inspiring, fascinating, and thought-provoking. Art is all around us and in many different forms, although the real beauty of art is that it can tell a story without saying a word. And like art, those moderate to severe frown lines between the brows can also say a lot about a person.
It started to make me look like I was either concentrating too hard or I was a little bit stressed out.
I was home for Christmas and I was reading a book, and my mom said, "You look like you're frowning."
I think it's because I started to look angry or something all the time because the lines were there.
Over time, movement of brow muscles causes the skin to crease. As skin becomes less elastic, repeated frowning creates lines and wrinkles between the brows. Botox Cosmetic is a purified protein produced by the Clostridium botulinum bacterium that relaxes the muscles by blocking nerve impulses. With a few tiny injections, Botox Cosmetic blocks the release of acetylcholine, the chemical that causes muscles to contract. With less movement, the facial muscles begin to relax and the lines begin to fade. You'll still be able to frown, smile, or look surprised, but without the creases and wrinkles between your brows.
I'm very satisfied with the results.
My expectations were definitely met.
It was no big deal, and the results were just right on target.
I'm 61 years old and proud of it, and whatever wrinkles I have, I've earned them. My name is Joan, and I'm a patient at Essentially Bare. Before coming to Essentially Bare, I did an evaluation at one place that was a doctor's office, and the nurses there really weren't that helpful. I mean, they couldn't tell me, well, this treatment will help you in this way, and this treatment will help you in that way. They just showed me the list and said, what treatment do you want? Well, I'm not an expert, and I didn't know. And so that's why I was so pleased to find Kelly and have the expertise here. Everybody here is wonderful at Essentially Bare. I love Kelly. In fact, part of the reason I started here was I really needed advice. I didn't have a sense myself of what was needed, and so I showed up for one of those evaluation sessions, and I said, here's my face, what do I need? And she helped me sort out which of the treatments would really be right for me. Of course, I had some wrinkles, but you know, that didn't bother me so much, but my face felt sort of saggy along the chin line, and I didn't like that. And I had age spots, and I really didn't like that. I've always had some capillaries around my nose, and I didn't think about the fact that that would be something that could be dealt with, but it turns out we dealt with those too. I had photofacials for the sunspots and the capillaries. Each time I come, I have it again, and it's partly because I'm in Florida a lot, and I run and I'm outside, and so even when I wear a hat and sunscreen, you know, the age spots come back. In fact, I have one here right now, and so each time I come in, I get whatever has accumulated in the intervening time. Actually, it was bad enough that I was considering surgery, and then I came in and Kelly said, well, let's do this fractional laser thing and see if you like it. And I did. It was like, it makes your face build natural collagen, and so it just plumps up your face, and it looks totally natural. It doesn't look like you've pulled your skin up or anything, and it's just enough to tighten up my jawline and just generally give you kind of a more healthy look. I do it when I start to feel like it's going away, so it's probably every maybe 4 or 5 months, and then I come in for the fractional. I know it's called resurfacing, but it doesn't feel like resurfacing. It feels like it's something underneath my skin. I can feel when I need a fractional resurfacing treatment because my face starts to lose some of that nice kind of plump natural feeling. I recommend Essentially Bare to all my friends, and I've had several come, and they've been very pleased.
Restylane is the #1 selling dermal filler in the world and has been used in over 1.4 million treatments in the U.S. alone. It is the world's most studied cosmetic dermal filler. The Restylane family of products includes Restylane and Perlane. Both are cosmetic dermal fillers that replace lost volume and restore youthful contours to the skin to smooth away moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth. These products are proven to deliver long-lasting results due to a patented stabilization technology. Restylane lasts about 6 months. Perlane lasts at least 6 months in a majority of patients. If you're considering facial wrinkle correction, there are a few things you should know about Restylane and Perlane.
I feel young inside, so I definitely didn't want to look old on the outside. And when I noticed the smile lines were getting deeper, especially after looking at a photograph, I realized then that, yeah, I don't want to feel old, so I'm not going to look it.
These products do not use animals as their source of hyaluronic acid. Instead, Restylane and Perlane use a biotechnical process of bacterial fermentation as their source of hyaluronic acid. This limits any risk of animal-based disease transmission or allergic reactions. Restylane and Perlane are biocompatible with the body's own natural hyaluronic acid, and no allergy testing is required.
The reactions that I've received since getting Restylane have been just wonderful from everyone. As a matter of fact, just last week I had a table full of girlfriends staring at me, and they finally said, "What did you get done?"
Young skin is smooth and elastic and contains a lot of hyaluronic acid, which is found in all living organisms. Naturally occurring hyaluronic acid binds water to give volume to the skin, shape to the eyes, and a lubricant to joints. However, as the amount of hyaluronic acid decreases with age, less water is bound, and the less fluid in the skin, the less elasticity. In time, this may create wrinkles. This woman had the lines from her nose to the corners of her mouth, known as nasolabial folds, corrected with Restylane. This was how she looked before Restylane. This is how she looked after. This woman also had her nasolabial folds corrected with Restylane. This was how she looked before. Here are her results. This woman had her nasolabial folds corrected with Perlane. This was how she looked before treatment. This is how she looked after Perlane treatment.
I own thousands of dollars in products, thousands, and I would rather spend a few hundred and get something that works immediately. My name is Karen, and I'm a patient at Essentially Bare. So I had what I thought was adult acne, and it was rosacea. Well, you know, you're talking to your boss and their eyes will like drift over to like your beet red cheeks with a big breakout, and you know what they're looking at. I came here, and Kelly, who owns Essentially Bare, gave me some rosacea treatments that were remarkable. We did some microdermabrasion, which sounds harsh, but it really worked. When the rosacea laser came out, that was the trick that cured me. I had a few in the beginning, but then once the flare-ups died down, it's maintenance maybe once or twice a year. So if I'm having a stressful time and I notice my rosacea coming back, I will book an appointment, and it lasts a really long time. I'm very happy with the results. I would recommend Essentially Bare, and I have recommended Essentially Bare. They do everything from laser hair removal to Botox treatments, chemical peels, microdermabrasion, IPL, I mean, you name it, they do it. And they're very professional.
Fabulous. Effective, they work.
Right away, I mean, within 20 minutes, I noticed my skin was a lot drier. The forehead, the cheeks, all the places that are usually problem areas.
I could tell by an hour or two. I could see a vessel that I knew existed on my face that was red and blotchy, and it was no longer there.
Looking in the mirror, like my skin tone has gotten better.
The light pulses target the pigment in hair follicles and sunspots, the blood in visible veins, and the bacteria that causes acne. The procedure is non-invasive, and the treatments are fast, safe, and effective.
My name is Lauren, and I'm a patient at Essentially Bare. When I come to Essentially Bare, I usually get a laser hair removal treatment. The treatments have been very successful for me. I've had treatments on my legs, my underarms, my bikini line, and I don't really have to shave anymore, which is a wonderful thing. The staff are very knowledgeable, they're helpful, they make you feel comfortable when you come in, and you feel confident in their abilities to do the procedures that you're having done. I was concerned in the beginning that I wouldn't be able to afford laser hair removal, but found that Essentially Bare worked with my budget. They didn't require me to sign up for a package or anything like that. It's wonderful. You just put on what you want and go out into the world.
Segment, do you have brown spots on your face that you'd like to get rid of? How about a tattoo that's outlived its usefulness? The Spectra laser is the newest weapon in the anti-aging arsenal that can treat everything from melasma to pore reduction. Dr. Jody Comstock joins us now with some information on this. Thanks for being with us. This sounds like a kind of a do-it-all kind of laser. Tell us about it.
Well, the Nd:YAG laser, which is what the Spectra laser is, has been around for a long time, but it's been tweaked, and now that has really been simplified and perfected. And they relaunched the Nd:YAG laser this year. It's had 10 years of experience in Asia, and we specifically looked into it for melasma treatment, or that extra pigmentation that you see with all individuals, especially dark hair, dark eyes.
Okay. Let's take a look at some pictures of some befores and afters. You can talk about them.
What happens is this laser also helps treat acne. This young woman has had a treatment of the laser, and it's especially nice for someone who does not want to do oral antibiotics. So it's another alternative for treatment and no downtime.
And how many treatments typically do you need?
It can range from 1 to 2 to 3. We'll suggest 1 treatment a month for a bit. Some patients will do 1 treatment every 6 months. It's specifically great for pore size, and you can see with these dilated pores on the central face how they shrink up. And as we age, we get more dilated pores, and dark hair, dark-eyed individuals get centrally dilated pores on their nose and inner cheeks.
Okay. And that just really, you can see the difference there.
I know,
That's
it's
amazing.
Great. It is really nice. These are seborrheic keratoses. These are benign growths. They're caused from the sun, and many people will get lots of them. We treat thousands a day in our practice. This laser is very nice with no downtime. 1 to 2 treatments will take care of these lesions without leaving any mark or scar.
Does a particular skin type tend to get these?
Actually, we see them on all skin types, and as we age, we get them, and it's just non-discriminating. And this is for tattoo removal. It's called selective photothermolysis. This means it selects a specific color and pigment, and the nice thing about this particular laser is it hits all different colors, all different wavelengths. Unfortunately, you do need several treatments, as in all tattoo lasers, but it does not scar. you really get a beautiful result after various treatments.
But as you can see on the last picture, it doesn't totally take it away, does it?
It can, and again, this individual has had 4 treatments, but you could do more treatments, and we would suggest possibly 7 to 10 to get totally rid of it.
Okay, especially the darker
But some may go away with even 3 treatments, especially if they're not professionally done. It actually also treats broken blood vessels. And fine broken blood vessels, again, we get with photo damage on our skin, and this is after treatment, the skin just looks very refreshed. Patients love this because there's no discomfort and their skin looks great right away. They don't have to have the healing. And again, with this pigmentation, this is classic melasma, and sometimes we can lift this with creams, making sure patients wear good sunblocks, but some individuals it's just very, very stubborn, and this is now our treatment of choice for stubborn melasma.
This is a great example of melasma.
And again, you'll get this discoloration, and it gets hard to cover with makeup, and over time it gets darker and darker. And so this is a nice non-invasive treatment option for individuals.
And let me ask you something else. Once you deal with melasma like that, if you don't wear sunscreen, will it be back?
Yes. And so individuals who have this treatment really need to be on a great topical regimen. Melasma comes from hormones and sun exposure, so you need to be wearing a zinc oxide or titanium dioxide sunblock on your skin. We encourage bleaching agents and retin A. Always try those things first. Stabilize your color cells and then undergo treatments. But no other lasers really work and can make melasma worse. So you're really stuck with peels or doing this new Nd:YAG.
And is it a painful laser?
No, it's not. Patients love that because it doesn't hurt, very easy, and all patients are back for more because it's really not bad.
Okay, and it's called one more time?
It's called the Spectra laser.
Spectra laser, because they'll want to know what to ask for.
Exactly.
One of the newest and most exciting laser treatments we offer at the clinic is called the Spectra Peel. The Spectra Peel uses what we call a Q-switched Nd:YAG laser and involves us applying a carbon-based lotion to the patient's skin. A typical patient who might benefit from a Spectra Peel is somebody who has enlarged skin pores, mild acne scarring, active acne, and once we've applied the carbon-based lotion to the patient's skin, we wait 20 minutes and then we start applying the laser energy. The carbon particles will attract the laser and therefore cause localized heating in that area. As a result, the patients will often notice that the skin appears smoother and that there may be a reduction in the size of their skin pores.
The Spectra Nd:YAG laser is a dual-mode Q-switch laser with 4 distinct wavelengths and a patented long pulse mode in one system. The high-intensity pulses of light create a photoacoustic wave that significantly lightens or completely removes pigments and tattoo particles without harming surrounding skin. This energy shatters the ink molecules at such a high rate of speed that they vibrate and break up microscopically. Traditional lasers require anywhere from 6 to 15 treatments, depending on the ink density and coloring. The Spectra laser effectively treats all ink colors in an average of half the number of treatments, saving significant time and money.
Hi doctors, I have 3 beautiful kids, but they left me with this loose, saggy skin on my stomach. Should I get a personal trainer and hit the gym even harder? Or should I talk to a plastic surgeon about a tummy tuck? Or is there another doctor that can help me take care of this less invasively?
Well, Dr. Sandra Lee is back with her patient who you just met in the video. Kelly, how are you?
Hi, good.
And so the question is, you know, we're talking about loose skin after pregnancies. So who do you go see? What kind of doctor for loose skin in your tummy? Is it the plastic surgeon or is it the dermatologist? Potentially both. So I had the opportunity to examine you before we started the segment. I mean, you are buffed. You are in good shape, but you have that loose skin. And unfortunately, no amount of diet and exercise is going to cure that. So, you know, there's a number of options that you can do, and I think you did all the right things leading into your pregnancy, during pregnancy, and after. You took good care of yourself. You're going to the gym now. Your muscle tone is great. So you've done that option. Number two is coming to see me as the plastic surgeon. And you are a good candidate for a tummy tuck. And because you're so in front, we could do what we call a mini tummy tuck through a small incision like that, tighten those muscles, and just remove that little bit of overhang. So that's the second option. But finally, that's where Dr. Lee comes in. We have so many great non-invasive or minimally invasive procedures to get some skin tightening.
If somebody doesn't want to go through a more invasive procedure, if they don't want to have surgery. And I really have here the newest and the greatest of all the radio frequency devices. This is Reaction by Viora. You're able to treat at multiple frequencies, and so you can be more specific with the depth in which you're treating with this device. You know, you can treat cellulite, you can tighten skin, and it has vacuum as well, so you can suck the tissue up and you can even penetrate more deeply. And we can even use a specific handpiece here to actually target stretch marks as well, so we can help to improve stretch marks.
So it's twofold. It's getting some tightening and also helping stretch marks. How's that sound?
Let's try it, right?
And you're going to do a little bit?
Let's fire it up here. Yes, we're going to show you what it's like. And you're going to be so nice to hold the temperature sensor.
And this is the temperature sensor because it's so important.
You can see how it's vacuuming up,
it sucks
pulling
it
the
up
skin
in
up
there,
into
pulls
the
it
area.
in.
And we can go back later and change the handpiece and actually directly try to improve the stretch marks as well.
How's it feel?
It feels like someone's pinching me,
So,
but not hard.
Kelly's a good candidate.
Yes, Kelly's a good candidate because she's already so fit, and we just have this one trouble area, and also because she doesn't want to go through a more invasive procedure. And you can use this to treat all areas of the body. The neck is a very popular area, the thighs, the tush. So it's really just a great and easy way to do it. No downtime.
How many treatments is she going to need?
6 to 8 treatments, really spaced every 2 weeks, and it's about $1,200 to $2,000 for the package, like for 6 treatments.
And I know, Dr. Lee, you brought some before and after
Yes.
pictures supplied by the company of what kind of results. Obviously, I think this appears after multiple treatments.
Well, that's 4 treatments. 4, 6
I mean, those are
treatments.
pretty dramatic changes.
Yes.
I mean, you can still see some laxity there that you can get out surgically, but for someone who doesn't want surgery,
this
pretty
is a nice
change.
option. Yes.
Part of the deal here, Dr. Lee has been so kind enough to agree to do a couple more treatments for you and get you in shape. I'm jealous.
As a board-certified plastic surgeon who is busy with plastic surgery, I'm very interested in helping patients with radiofrequency. Radiofrequency is very important, has been for years, but now with using bipolar devices, multi-frequency device, all in one handle, we can offer patients improvement to the skin in many parts of the body, face, neck, chest, body. And that's an amazing device.
Dr. Mann and I, we're operators. We like to cut. We prefer to do the surgery, but for a number of reasons, surgery isn't always the #1 choice for them. Either they're not ready for a more invasive, let's say a full body lift or a full facelift, so radiofrequency tightening would be a good option, or somebody just doesn't want to go under the knife for whatever reason, they're afraid, or other health issues.
Absolutely, it can be scary.
So it gives us something that we can offer to non-surgical patients.
So this is a great option. I'm sure our viewers would like to know what you all think about these technologies. What are the advantages and disadvantages of each? Dr. Humes?
Well, depending on what you're looking at, I really do like a lot of the different technology. But for me, what I'm using mostly is radio frequency. What I like about it is that it does cause programmed cell death or apoptosis, and it's getting deep into that fat layer like we were talking about before.
Dr. Mann?
Yeah, since you mentioned reaction, I like this device because what I find out that in the single handle, you can do multi-channel, multi-frequency areas of the bodies. And it depends if it's a thick skin or thin skin or old or young. You can go with different kind of modalities and get deeper or more superficial.
And then any disadvantages?
With that, not really. You know, there's really no downtime. It doesn't hurt that much, and you don't need any pain management.
So these are all quick procedures, in and out, great results?
In and out, 30 to 60 minutes, depending on how big the area is, and we're seeing great results.
Very
I've
little
even had it done.
recovery. You go back to exercising much quicker than if we were doing a body contouring surgical case. So those are some of the advantages. You know, it's been out for years now, but they keep improving the technology all the time, and I have to admit, I've had a little bit myself. And it works. It's for women, for men as well, and younger, older. It really is a great alternative for most patients.
Especially if they have vacuum also in it, so the tissue gets closer to the device and you can go deeper or more superficial. Very comfortable.
That makes perfect sense. And Dr. Mann, I understand, though, that you believe in this treatment so much you actually did it yourself?
Right, exactly right. The staff did it for me, and if it's good for me, it's good for patients. And you could see this was done like this, slowly over the jawline, and it decreases the jowl, and it gets a better definition to the neck. If you look at the pictures, you can really see that the jawline is much more defined, the neck is tighter, the jowls are less, and the overall appearance is superior compared to doing nothing.
Well, clearly it's worked for you. He looks pretty good.
I was going to say, you look fantastic.
Thank you.
Good for you. Natural look and no downtime.
How's that sound?
That sounds pretty good
That's
to
what
me.
we're striving for.
You can sit down. I want you to relax. We're going to tackle a big thing today. We've been battling the bulge since the beginning of time, but how we lose weight has been up for debate for decades. Watch this.
There is no downsizing when it comes to the multi-billion-dollar weight loss industry. In the 1970s, we were introduced to diet pills. In the 1980s, we saw a rise in surgeries such as liposuction, which came with a painful and long recovery time. Since the 1990s, weight loss surgeries have been moving toward more non-invasive procedures with fewer side effects and shorter recovery time. Today, we're showing you the latest weight loss treatments promising to help you lose weight fast.
All right, please welcome Dr. Melissa Hirschberg. This is a great find. I think everyone's going to be talking about this conversation today. The latest non-surgical weight loss procedures. Anyway, revolutionary new procedure about that loose, baggy skin under your chin. You know that? Well, we're going to talk about that. What's it called?
So this, we're going to be talking about the relift procedure by reaction.
All right, we're going to see how it works. We're going to walk over there in a minute?
Sure.
Okay, tell me about this, how it works out.
Okay, so this is really cool. This is brand new to Canada, and it's brand new technology, and it uses 4 different modes of radio frequency, of vacuum suction, and heat to target the different tissue layers. So what this is going to do, unlike the others, is it's going to target the skin level to give a lift and a tightening. It's going to stimulate collagen and elastin, and it's also going to go lower and shrink the fat cells. So it's not going to destroy them, it's just going to shrink them. So you can see more immediate results.
Okay, and does it last for a long period? Is it forever, or you just have to?
So the other ones destroy the fat cells. When you destroy the fat cells, you're not going to get them to come back. If you gain weight, it will come in other areas.
Okay.
This is more like when you lose weight through diet. It's going to shrink the fat cells. So if you then go and, are not working out at the gym and you're eating a lot, it will come back.
Yep, we all know that. We all know that. So let's go see how this one works. You know, we're not going to see the results right away, but certainly we want to see what it looks like. And we have somebody in our audience. Her name is Gail. Thank you for doing this, Gail.
My pleasure.
Okay, take a look at what's going on here. So walk me through this, Melissa.
Okay, so what we're doing here is using the transducer to target the area under her chin. So what happens as we age is we lose fat in our face. And when we lose the fat, what ends up happening is the skin sags and we get this collection. We get this jowls under here. So what we're doing here is we're tightening and we're lifting. So we're going to get a nice contour. And then you're also penetrating deeper, to work on reducing the fat that accumulates there. So here we're using it just for this area, but this can also be used on the abdomen. It can be used on different areas. And what this is awesome for is, let's say you've done the hard work and you've lost a lot of weight, or you've been pregnant and now you're back to your goal weight, but you have that sagging skin.
Yes, yes.
This can really help tighten that up, and the results can be amazing. So it's almost like a non-surgical tummy tuck, and it can also help with the stretch marks.
That's
so this is a really
good.
new, innovative technology.
Wow. And so how many visits before you see the results?
So this would be more. So you can see instantaneous results with this, but they recommend that you do come back more than once. So you will come back maybe 6 to 8 times.
Sure, sure. Yeah, and again, prices may vary depending on what clinic that you go to.
Right.
Okay, here's the before and after, what it looks like after, you know, depends on how many visits you actually need, but there is a significant difference right there. Significant.
Yeah, it looks
That's
amazing.
pretty amazing.
And how does it feel? Very comfortable. It feels like a deep tissue massage.
I can't hear you, but that's what she's, can we hear you? Okay, there you go. Go ahead.
It's very comfortable. It feels like a deep tissue massage. It's very pleasant.
Very pleasant. Do you want to stay there for the remainder of the show?
Absolutely. She can go head to toe.
You could be here for 6
Lift
visits.
right
Okay.
up.
Lisette is here today, along with Dr. Orden in our exam area.
Welcome, Lizette.
Nice to be here.
And Dr. Travis and Lizette's such a lovely lady. But, I mean, take a look at this. This is a pretty prominent facial vein that you see. She really has it in that one spot, and it shows. So we have a great new treatment, Vein Go. How do you like that name? I love that.
Play upon
Isn't that pretty
Vein Go?
cool? All right, how does it work? A real fine needle point apparatus that I have here. High voltage, high frequency, pinpoint cauterization of the blood vessels. What is it doing? It's coagulating the blood, collapsing that blood vessel, okay? Lizette's got facial veins. This can be used in any part of the body, and typically you only need one treatment.
So immediate results.
Immediate results.
Does that excite you?
That's amazing.
So what I'm going to do, Travis, I'm going to start, and what I do, I put the applicator right on the vein. I put a little pressure. Do you see that blanching? So cool.
Lisette, you're doing okay?
I can hardly feel it.
You're gonna be very happy.
So
with
Travis, I'm not, you know, compared to other vein techniques, this is not sclerotherapy. This is not laser therapy, but I'm actually pinpoint eradicating the vein. Do you see that vein?
that. And that'll never come back.
It should not. So I have to move 1.5 millimeters on each one of these little treatments. We don't want to rush for Lizette. We want
No,
this.
not at all. And so
we
this
want
is a
this
treatment, though,
perfect.
you can come into the office during your lunch break, and just like that, you have to have a little patience, obviously.
So many.
Are you all seeing this on the screen? Because if you're watching this at home,
Do you see the whole
just like that?
The whole upper half of the,
Don't.
and we're not done yet.
We're gonna get this where you want it to be, and I can't wait to show everyone the before and after. And this is literally in a matter of minutes.
We're getting there. Like I said, it's a new product, but it is available in most parts of the country, and you can go online and find out who in your area has the Van Gogh system.
Literally, that vein is collapsing on itself because it's that blood in the vein that you're seeing with those unsightly facial veins, and it's collapsing.
Almost there.
The minute that vein is collapsed, it's no longer visible.
The heat is going into the vein, and it's not damaging the skin per se, and that's what's different with this.
And you barely feel this.
I'm surprised. I can barely feel it.
Well, the needle is
Almost
so
there.
small.
That's why I'm wearing my glasses. In fact, sometimes I wear microsurgical loops to do this.
Wow.
Do you see that?
You know
Dr.
what?
Travis?
I want to pull up your before photo and do a live split so everyone can see how incredible this procedure is. So let's pull up the before and a side-by-side after. Wow. Now everyone else gets to see it but you, right? Well, that's no fair.
Well, I think we have a mirror somewhere here.
I think maybe
You're
there
sitting
it
on the
is.
mirror. Why don't you sit up for us? Lizette, you want to hold the mirror? I'm going to pull your hair back. Do you see that? Where
Wow.
that vein used to be, right there?
It's vanished.
You know, there's just slight white tinge to it.
But that'll clear up.
Oh, that's going to go away in 24 hours or so.
It's gone.
Looks really
So
good.
do we have a happy customer?
Amazing. Very happy.
Well, thank you for being here.
Good job.
Dr. Orden, great work.